Hello guys, today we start talking about inflammatory disease of glandular organs, lymphatic system and blood vessels. And of course we will delay this lection for few parts because first of all I want talking with you about glandular organs and their inflammation because it is not the similar topic like the inflammatory of the blood vessels or lymphatic system. Yeah, this is the reason why we delayed this lection for few parts. First of all, of course, you see the disclaimer, and first of all, we will talking about the endocrine systems. The complex interplay between the endocrine and immune systems causes the insurgence of endocrinopathies following severe inflammatory conditions and in turn the propensity to develop inflammation as a complication of endocrine disease. There you see the picture where you can find every endocrine organs what is interesting for us and how you understand not of all of them we will talking just about few organs. And there on the picture you don't see one organ what is very interesting for us, and this because it is a man. Yeah, the organ what is interesting for us we'll discuss in the next lecture, and there you will understand what the organ has the woman. Yeah. However, the endocrine glands may also be directly involved by infectious and inflammatory process, both in the course of systemic disorders and in the form of organ-specific or even cell-specific disease. Almost invariably, infectious and inflammatory disorders of endocrine tissues lead to a decrease in hormone production and activity and may ultimately result in severe and even life-threatening conditions if left untreated. As these disorders may be clinically under-recognized, the pathologist should be aware of the basic principles of their pathogenesis and be prepared to recognize their morphological features and clinical pathological correlations. When faced with histopathological samples of the affected endocrine organs. Not infrequently, inflammatory and infectious disease may appear as tumor-like lesions of endocrine organs and simulate neoplastic processes. Indeed, the careful observation and identification of the inflammatory and stromal cell populations supported, when necessary, by the wise employment of a selected panel of immunohistochemical markers, may not only help to recognize the non-neoplastic nature of a pathological process, but can also provide important clues to the pathogenic mechanism and, in some cases, the etiological agent involved in the disease. Infection disease of endocrine organs may be caused by a variety of microbial agents, including viruses, bacteria, fungi, and even parasites. The clinical correlates and the histopathological aspects of this disease vary according to the type of microorganisms, the immune status of the host, and the organ involved. Generally speaking, bacterial infections are very rare and are more frequently observed in the adrenal glands, whereas viral infections tend to be more frequent and may involve all endocrine organs. Intriguingly, viral infections of endocrine organs have also been suggested to have a role in the development of autoimmune endocrinopathies. Fungal infections and parasitic infestations are exceedingly rare. Non-infectious inflammatory disease of the endocrine organs encompass a variety of autoimmune and more generally immune-mediated conditions that can selectively affect one gland or involve multiple sites of the endocrine system, autoimmune polyendocrine syndromes. Infectious disease in endocrine organs. This picture repeat the endocrine organs, but in these pictures we don't see one very important endocrine organ, but of course we see the male and female. Thyroid infections. One of the most common manifestations of thyroid infections is acute thyroiditis. Acute thyroiditis is a rare condition, clinically characterized by fever, chills, neck pain, and signs and symptoms of neck mass related to increased thyroid volume. Thyroid function is usually normal, but thyroid toxicosis may intervene due to thyroid cell destruction. The most common causes of acute thyroiditis are bacterial infections, most commonly sustained by Streptococcus pyogenes, Streptococcus pneumonia, or Staphylococcus aureus. Primary thyroid infections are exceedingly rare, and acute thyroiditis usually represents secondary localizations of systemic infections or adjacent structures involved by pyogenic bacterial infections. Congenital abnormalities such as piriform sinus fistula or more rarely bronchial purge remnants are the most frequent causes of acute thyroiditis. Thus, this condition is more frequent in children than in adults. Other conditions and risks mainly responsible for adult cases are immunodeficiencies of various types, trauma, or rarely medical procedures such as fine needle aspiration of thyroid and parathyroid surgery. Thyroid carcinoma may be another predisposing cause. The diagnosis is usually confirmed by fine needle aspiration, which allows samples to be obtained for both cultures and cytological examinations. In cytological samples, acute thyroiditis is characterized by numerous neutrophilic granulocytes, necrosis, and fibrin, depending on the severity of inflammation. And if we talk about needle aspiration, we talk about big needle. We do the punction of the organ, take some cells for diagnostic, and this we call needle aspiration. I never do the needle aspiration of the organs, but one time I do the needle aspiration of the fat tissue. I think it's not like the same, but it is harder. Surgical drainage may be useful in case of abscess formation and resistance to antibiotic treatment. Large abscess may require surgical intervention with drainage. In rare refractory cases, surgery with hemithyroidectomy or total thyroidectomy may be needed. Systemic viral infections may cause granulomatous thyroiditis, similar to the Carvens thyroiditis. See later in the text, which, however, is more likely caused by an autoimmune reaction within the gland. Interestingly, subacute thyroiditis has been seen as a complication of CoV-2 infections and following SARS-CoV-2 vaccinations. In immunocompromised hosts, fungal thyroiditis may arise mostly in the context of an Aspergillus systemic infection. In these cases, symptoms related to thyroid function are frequently neglected, and the diagnosis is made at autopsy. Cases of thyroid infections by pneumocystis carinii have been reported in patients with acquired immunodeficiency syndrome, but in the era of antiretroviral drugs, they have disappeared. Infections of the adrenal glands are uncommon and are mainly the result of disseminated disease. Interestingly, infections are often asymptomatic unless they destroy a significant amount of adrenal cortical tissue, resulting in adrenal insufficiency, Addison disease. Worldwide, mycobacterial infections, particularly Mycobacterial tuberculosis, causes a significant number of cases of Addison disease in developing countries. Tuberculosis is the second most common cause, after autoimmune adrenalitis, of primary adrenal insufficiency, particularly in the non-Western world, where tuberculosis remains endemic. Yeah, and you see the symptoms of Addison disease. Systemic infections, particularly those associated with bacterial sepsis, resulting in vascular collapse and disseminated intravascular coagulation, can result in acute adrenal insufficiency due to adrenal hemorrhage. Waterhouse-Friderichsen syndrome (WFS) is most commonly associated with meningococcal septicemia, but may be seen with other types of bacterial sepsis and rarely with viral infections. The adrenal gland is reported to be the most common endocrine organ affected by fungal infections, which can be either asymptomatic or associated with adrenal insufficiency. Individuals who are immunocompromised have increased susceptibility to infection. However, immunocompromised individuals can have isolated adrenal gland involvement from by a variety of fungal organisms, including histoplasmosis, blastomycosis, and coccidioides. A recent study from India found male predominance and non-compromised immune status to be particular characteristics of adrenal histoplasmosis. Fungal involvement of the adrenal gland may be incidental and asymptomatic or can be associated with adrenal insufficiency. Viral infections may cause adrenal necrosis and vasculitis either by a direct cytopathic effect or as secondary effect of the inflammatory process generated by their presence. Viruses such as the human immunodeficiency virus may be associated with adrenal insufficiency. Most recently, the impact of SARS-CoV-2 virus infections and vaccines on the endocrine system, including the adrenal gland, has come to the forefront of the literature involving infections and the adrenal gland. Angiotensin-converting enzyme 2, ACE2, and transmembrane protease serine 2, TMPRSS2, are viral receptors using which SARS-CoV-2 enters host cells. As both these two enzymes are expressed in adrenal tissue, and it is possible that SARS-CoV-2 could infect the endocrine system. ACE2 and TMPRSS are co-localized in adrenal cortical cells. Individuals with COVID-19 who are critically ill have been found to have lower cortisol levels compared to critically ill patients without COVID-19, and adrenal insufficiency has been reported in the setting of COVID-19. The next one, infections, it is a pituitary infections. It is infections of the pituitary glands. It is rare, often difficult to diagnose. Signs that can mimic neoplasm clinically and by imaging. Infections can result from disseminated spread, trauma, surgery in the area, or locoregional spread, sinonasal tract most commonly. Abscess of the pituitary gland are a result of either hematogenous spread or direct extension from infected surrounding structures. While most abscess present with mass symptoms, similar to pituitary adenomas, panhypopituitarism involving both the anterior and posterior pituitary function may arise in some cases. The most common surgical finding in pus in the sella on pathologic examination, acute and chronic inflammation are seen. Special strains may be helpful in elucidating a causative organism. However, an etiologic agent is identified in less than 20% of cases, with Streptococcus and Staphylococcus being the most common ones. There you see the picture of pituitary gland. Other infections of the pituitary gland may rarely be infected by Treponema pallidum, these days mainly in immunocompromised patients, Mycobacteria tuberculosis, particularly in developing countries. Fungi may also rarely infect the pituitary, usually by direct extension from surrounding structures or disseminated disease. A variety of viral disease may also affect the pituitary, including herpes viruses, tick-borne viruses, and hemorrhagic viruses. These viruses often cause meningitis and involve the pituitary in a secondary fashion. More recently, infection by SARS-CoV-2 has been associated with pituitary hemorrhage, infarction, and hyperfunction. Parathyroid gland. Infections of the parathyroid are rarely of clinical significance and are mainly due to systemic infections identified at post-mortem examination. There you see the picture. It's not good picture, yeah, but I'd like it because there you can see the diagnostic criteria and clinical features of any infections of some adrenal of some endocrine pathology. Thank you for your attention, and I repeat you that it is not the last lecture about the glands inflammations, and it is just little information for you to start understanding what is the inflammation of the glands and how we will talk about them. Thank you very much. Have a nice day. Bye bye.